Today I thought I would like to talk a little bit about MS and HSCT. So MS is a chronic autoimmune disorder or disease of the central nervous system that mostly affects young adults. So what MS basically affects is the central nervous system, and in other words it means that the immune system is defect or it doesn't work properly. Or some might say that it's hyperactive, it's overactive, it's not doing the things the way they should be done. So when a body confronts an infection or infection occurs in general, the immune system is triggered to work, and the immune system sends some nasty little lymphocytes to fight the infection. And in this case, people with MS have these bad guys called lymphocytes that are part of a type of white blood cells. And these guys, I think they must not attack the intruder, but the body's own cells, which is basically the autoimmune reaction that is involved in every single autoimmune disease. Lymphocytes, in this case, they think they have to attack neurons, and this will cause the inflammation in the central nervous system and will lead to, of course, neurological symptoms that can be anything from vision loss, complete blindness, sensory problems, paralysis, poor balance of symptoms. New symptoms or old symptoms last over 48 hours, 2 days. You have symptoms, you go to hospital, and usually you're giving corticosteroids as an IV treatment, a heavy dose, and that tries to fight the inflammation and make the recovery faster and better. But in every single case, there is no cure for this. And soon, for that matter, I will be talking about HSCT as the most effective treatment for MS. And currently, there are 4 known types of MS. The most frequent is, and basically in that form of MS, you just keep having these relapses, and many times these symptoms tend to go away. You will recover from the symptoms, and sometimes people do not recover that well, but they still are considered MS patients. And in the other group of MS patients are the secondary progressive, the SPMS patients that used to be in the earlier stage, they used to be RRMS, and later they developed into being, usually sometimes relapses do occur, but there is no active inflammation of the central nervous system. Instead, there is some neurodegeneration that will take place, and it is the natural phenomenon of cells dying off when they've been attacked for a long period of time. And there is the third, the not so fortunate group of MS patients that have the primary progressive MS that will just progress from the very beginning to the very end, and there won't be any remission phases in between, and that is very sad. And then there is this fourth, less known group that consists of patients that do have relapses, but they also tend to progress. But the most common is the RMS, and currently there are only treatments, therapies that try to modulate the disease progression, but unfortunately there is no official cure for MS, and that is something that researchers are very hardly trying to in a pill, and then there are some heavier medication therapies, treatment. Every single therapy of these have only the possibility, the maximum capacity to slow down in the matter that there will be less relapses, but it doesn't mean that the progression would be stopped. And that's why I had sought for HSCT instead of continuing with the conventional therapies that I've been offered my healthcare provider. So there are several factors contributing to the onset of MS, and because we live in this very modern and highly developed world of ours, there are several factors. I'm going to list a few in the following. So MS is partially genetic. So if we think your mother or your aunt or your grandfather or some cousin of yours had or has MS, there is possibility that your children or some other relative of yours will develop MS or has MS, or he might doesn't know it. It's possibility, or that you will pass your MS, or your children will have MS. You never know because it's such a mysterious disease. But it's good to not think that you should not have children when you have MS. It's your own choice. And of course, if both parents have MS, it's highly likely that they will pass the disease on to their children. Has a great impact, since we live in this world that is highly different from the world it used to be during the Stone Age or the Ice Age. Nowadays, there are a lot of toxins, antibiotics, and other chemicals that are stuffed into the food we eat, the cosmetics we use, the clothes we wear, anything we consume. And that is very alarming and can very likely have some kind of effect to our system, the way our bodies work, the cells work, and any kind of radiation coming from the electronic. And another possible contributor to the onset of MS, of developing MS at some point of your life, is probably the location where you've been living for the longest time of your life, or you're currently living. Because vitamin D cannot be obtained the same from a pill as it's obtained from the sunlight directly. In Africa, there are hardly any MS cases. There are hardly any MS patients. They have their own diseases and illnesses. But here in the Europe, in the USA, in Canada, in Australia, there's so many people battling this disease and other autoimmune disorders. And this is just because of these factors I just named. The environment and sunlight, materials we use, the chemicals, the toxins, the metals, the antibiotics. When people get an infection, whether it's viral or bacterial, mostly they go to the doctors, and what they usually get is a prescription for antibiotics. When you eat too many doses of antibiotics during your lifespan, it will probably have an effect on your future medical history, if I may say so. And to conclude here, anything that triggers or somehow activates the immune system, whether it's an infection or stress or heavy exercise, physical exercise, or anything, that can lead to a relapse in people with MS. A very simple way of thinking this is, if you think of the immune system and the human as a system, as a whole, when it's in balance, it's natural. Because naturally you are what you eat, you are what you do, your body can adapt to some point. But when we have all this around us and we're giving all this extra, suddenly there will develop an imbalance situation where the body, the immune system is not anymore balanced. And the longer this situation keeps going, the worse the result will be. So this is the favorite part of mine, the HSCT, which stands for hematopoietic stem cell transplant. And most people just call it stem cell treatment, which is sometimes kind of a misleading because somebody might think that it has only to do with stem cells, which is completely wrong. The surprise factor in this treatment, this transplant, is not actually the stem cells, but it's the chemo agents that are used to suppress the rest of the immune system. So basically, HSCT is currently the most effective treatment for numerous of autoimmune diseases like MS, like lupus, like rheumatoid arthritis, or you name them. There are so many. So like I earlier mentioned, the chemo is the closest to cure, not the stem cells. Basically, the stem cells are just collected from the peripheral blood flow from here, from a PICC line, and then they're frozen, they're sort of purified. Some facilities don't do it, they just use the chemo, some other chemo just to replace this treatment, this phase. And then the patient will be given some chemo agents, some chemotherapy. There will be hair loss, there will be weakness, other symptoms like almost you were going through cancer treatment. But this is not for cancer, this is for autoimmune disease, to kill off the immune system that was not working the way it should have been. The chemo has been given and the patient has been left with nothing. You're basically starting from zero. Some patients that have gone it through call it the day one, the day zero, and then they start from nothing and they start the recovery once they have been given back their stem cells. And from that point on, it's up to the body to start the recovery phase. And basically you just go through a very, very slow recovery phase when you do rehabilitation, but physical exercise, physiotherapy, anything you think of. But you have to be very cautious, stay in isolation, because you basically have to remember that you are left with no immune system. The immune system, the new immune system, will grow back slowly, and you have to give it the time to make it's basically just like resetting a computer. When your computer stops working properly, at some point when computers, after 4 or 5 years, they start doing these tricks and you're losing your mind, you just have to push the restart button or the shut button, and then you just press it long enough and then your computer restarts on its own, and you will just have to wait and give it the time to bring back the data. And from that point on, you just hope that the computer will take the commands as it used to, and everything will work properly again. So that's the basic idea. Thanks for watching. I hope I didn't bore you. I hope you will watch the next video.